COVID-19 survivors may hold key antibodies that can help other patients.
Medical researchers looking into it, but the call for donors has reignited a debate over rules that keep some men from giving blood.
Jeremy Harris covering this story tonight. Jeremy?
Yeah, Heidi, recently the FDA, just this month, in fact, relaxed their abstinence requirements for gay men to donate blood plasma from 1 year down to 3 months. But that still leaves a lot of coronavirus survivors unable to help.
We were starting to feel more and more sick.
Boyfriends Lucas and Joshua were among the first COVID-19 patients in Utah.
I think we were like the 22nd and 23rd.
In March, they'd been on a trip to visit family in New York. When they got back, both had symptoms and tested positive for the virus.
And it was super aggressive, high fever.
After quarantine, they're doing much better. And they heard health officials want COVID-19 survivors to donate blood plasma.
I was like, oh my gosh, that's great. I'm surprised they haven't called us yet.
But there would be no call. Lucas and Joshua aren't eligible because they are gay.
It does feel discriminatory.
I think that the rules should be looked at again by the FDA.
This week, TV host Andy Cohen, who also beat COVID-19, called on the FDA to eliminate donation restrictions on gay men.
There is a war going on, and we're all being asked to adapt, and I think the FDA should too.
It's from the initial fear in the 80s.
Emma Afros with the Utah AIDS Foundation says the FDA policy is rooted in past fears.
It's a rather archaic policy.
He adds blood tests can now easily catch HIV in donated blood.
It is not based in scientific advancement.
And there's no medical reason for a blanket prohibition on gay donors.
And to be denied that simply for one discriminatory practice is quite harsh.
I think that there's still like such a stereotype that if you're gay, you're HIV positive or have AIDS.
Lucas and Joshua say they're grateful they beat the virus, but they wish they could help others do the same.
This whole pandemic is making us revisit a lot of things. And I think this rule is going to be one of them.
Now, the FDA says changes may be coming to this policy. Right now, they are starting a study with 2,000 gay men across the country to see if they can reduce or come up with some sort of scientific evidence that proves there's really no need for this abstinence requirement among gay men. They did give a big statement, and we posted that up on KUTV.com. Reporting live in Salt Lake City, Jeremy Harris, 2 News.